Yeah.
What's the name?
Leo.
What? Oh. This is Leo.
And Leo. I was like, I know there's two Leos.
So many Leos.
But you're the big Leo, right? I think I'm making good progress.
Luckily it's close, so I'm like, no.
We're not going to not stop working.
No. Lots of work to do. Great, Leo. How's Leo? Oh my gosh. You're in a yeah. No, I literally is here.
I remember when Arlia was that size.
Oh my god. He's like a teenager.
It's the sassy.
I forgot to. Okay, Leo, we're gonna go sit down, okay?
Beat ya, Brooke. Beat ya.
That's Dylan's chair.
Yeah. 8 hours outside. Seating whatever. Rest. Yeah. Nice. And then hay. Straw. It's good to hear. Yes, sir. You need to get out here.
The House Committee on Oversight will come to order. Before we take attendance, the clerk will read a letter in from the Speaker of the House.
In a letter dated May 20th, 2026, Dear Mr. Clerk, this letter is to inform you that I'm making the following committee appointment changes. Oversight Committee, remove Representative Penelope Cerniglou. Sincerely, Matt Hall, Speaker of the House of Representatives.
Thank you, Mr. Clerk. Next, will you please take attendance?
Chair DeBoyer.
Here.
Representatives Bierlein. Here. Representatives Meerman. Here. Paquette. Cara. Bruck. Green. Regis. Shriver. Wolford. Miller. Here. Pahutsky. Conlon. Here. McDonald. Menser. Wagella. Mr. Chair, you have a quorum.
Thank you, Mr. Clerk. Representative Bruck moves to approve the minutes of the May 19th meeting. Hearing no objections, they are approved. Today, the committee will be hearing a presentation on RX Kids, which is the nation's first community-based guaranteed income program that provides unconditional cash transfers to new and expectant mothers. Given the presentations will be Dr. Mona Hanna, founder and director of RX Kids, Dr. Where's she at? Do I see her? There she is. I'm sorry. I either can see close or I can see far. So please come up. Begin when you're ready. Red button on the microphone. Thank you.
All right. Can you hear me okay? Awesome. Thank you, Chair DeBoyer. Thank you, committee, for this opportunity to share more about RX Kids. My name is Mona Hanna, a pediatrician, a professor with Michigan State University, and the Associate Dean for Public Health, and the founder and director of RX Kids. So what I want to do today is tell you what RX Kids is, how RX Kids leverages state funds, what safeguards are in place to protect those funds, and our outcomes. And a sneak peek, it's healthier mamas and babies. But before I get into all those details, I just want to share some thank yous. We just completed a survey of participants in the program. We got back 3,000 comments from mamas across the state. And these are just a tiny bit of those comments. A mom in the UP, thank you for making pregnancy, babies, and parenthood a priority. This is what makes a good society. A mom in Kalamazoo, God bless you. You are taking care of those with the least. This is what Jesus did also. A mom in Gladwin County. This program changed my entire postpartum experience. My baby has gotten my full care and attention without being extremely stressed and overwhelmed with how I was going to afford her needs. Another mom in the UP. Thank you for allowing me to spend time with my newborn and not having to worry about affording things like formula and diapers while I was on unpaid maternity leave. Your generosity means more than I can say. We also have some RX Kids mamas with us here today. I'm not going to share all of their stories, but I want to share a little bit about Mercedes. Mercedes is in the corner over there. Mercedes is from Detroit. She just had twins, gorgeous babies. She just started a new job as a flight attendant. She wasn't eligible for paid leave yet, and she's thankful to all of you because RX Kids kept her and her twins afloat postpartum. We also have Kaya here from Detroit. Her baby was born January 1st, the first baby in Detroit. And she was hoping to work through her full pregnancy, but her doctor told her it wasn't safe, so she had to stop working. And it was thanks to RX Kids that she's able to breathe a little easier and to be a mom. So we have thousands and thousands of mamas that are thankful to every single one of you for supporting this program. And why are families so grateful? It's because the period of childbirth is the most economically vulnerable in the life course. Moms come out of the workforce. There's minimal paid leave programs. The half of Americans in this country, moms go back to work at 2 weeks after giving birth. And it's also a time when expenses rise. It's estimated that having the costs of just having a newborn in the first year is an extra $20,000. So once again, this is the period of life that is the most economically stressful, the maternal infant period. And as a pediatrician, we know that this is a period that is the most consequential. What happens in utero, what happens around the time of childbirth, what happens in those first few months of life shape an entire life course. Your brain literally doubles in size in that first year of life. And this is a program that values that period from in pregnancy to early childhood. It buffers families from that tremendous economic instability of that window so that babies are born healthier. So the solution that we developed is targeted and short-term support for moms and babies. Every pregnant mama in an ARCS Kids community gets $1,500 after 16 weeks of pregnancy. And then once a baby's born, it's $500 a month, either for 6 months, or for 12 months. And that's dependent on the community, on how much money is able to be raised in a community. The program was designed for simplicity, efficiency, and scalability. It was always the intent that we would build something that we could share with other communities across the state and really across the nation. The program was meant to be flexible. This allows families to best meet their needs. Some families need help with diapers, some families need help with childcare, some families need help with housing, and some families need help with transportation. And some families need help with food, and some families need help with utilities. So the program is flexible. It really kind of embraces freedom and choice, and parents' choice, to best meet their needs, similar to, for example, Social Security and the expanded child tax credit of 2021, which dropped child poverty to the lowest level. The program is also place-based. That's a critical design element. It is not necessarily for poor people, it's for poor places. And I want to talk about that a little more. So we very much understand that geography is one of the greatest determinants of health outcomes. If you look at this map, for example, the county of Roscommon has the lowest life expectancy in the state of Michigan. Lake County, another ARCS Kids community, has the worst county health ranking in the entire state. Detroit is the least healthy city in the United States. Where you grow up, the environment of where you grow up, the socioeconomic conditions, maybe because of the air you breathe, the water you drink, your access to fruits and vegetables, healthy grocery stores, safe places to play, school systems, all of these geographic conditions make it really hard for kids to grow up healthy and successful. So once again, this is a program that tests a community, not individuals, and is finally a solution that treats disparities at a community, place-based level. So the program was built and tested in Flint. That's where the program first launched. And this is thanks to philanthropy. The C.S. Mott Foundation came in with the first grant for this program. They came in at a level of $15 million, which is astounding, because they were also tired of Band-Aiding. They were also tired of treating the consequences of poverty, and they wanted to address the upstream causes rather than treat all the consequences after the fact. So they came in at $15 million. Other funders came in. And then in fiscal year 2024, this is the first time we received state money. So we've been in 3 budgets. So in fiscal year 2024, we received $16.5 million in TANF funding to support the program in Flint for 5 years. This was an MD HHS grant to MSU. So that allowed the program to launch in Flint in January 2024 as a proof of concept, once again with the intent to scale, and now we have since scaled to about 60 Michigan communities. I want to spend a little time talking about TANF. So TANF, as you likely know, is the Temporary Assistance for Needy Families program. TANF was created in 1996 by President Clinton, and it reformed our former welfare system. It used to be something called AFDC, Aid to Families with Dependent Children. Because of kind of bipartisan backlash, it was reformed to something called TANF, Temporary Assistance for Needy Families. States get a chunk of money, and they get to decide how to support families, especially poor families with children. Michigan gets about $750 million every year to support families with temporary assistance for needy families, and only about 8% of those dollars actually goes to cash assistance. There's an article in your packet from the Wall Street Journal, a recent article about the national really kind of misuse of these funds. Many states use the flexibility of these funds as a budget filler. And this really started in Michigan and the Granholm administration, where these dollars were just going to lots of other things, not to cash assistance for poor families. We are using a provision in TANF called NRST. It's a little wonky, non-recurrent short-term benefit. This allows you to give 4 months of cash assistance for an acute episode of need. And we have defined childbirth as an acute episode of need. If you remember that graph I shared, is the poorest time in people's lives is when they are having a baby. NRST allows us to, once again, use those TANF funds for cash transfers, but we can only use it for low-income people. And for ease of administration, we use Medicaid as a proxy of low-income people. MDHHS administers TANF. It monitors that. Our use of TANF was approved by the federal government, by the Administration for Children and Families. It is embedded in the Michigan State TANF plan. And our use of Medicaid is matched with Medicaid, so it's a high integrity match, and only after that match do we invoice TANF. So I just want to kind of give a big overview of what TANF is. It is the federal cash assistance program. It is a flexible state block grant. That state block grant, Michigan and many states do not use it for cash assistance, but this is really using it for its intended purpose, and it's become a model actually for other states who want to once again use TANF for what it was intended for. So since launching in Flint in January of 2024, we have expanded thanks to really kind of bipartisan support, thanks to champions across the state. In 2025, we expanded to 20 Michigan communities, including 5 counties in the eastern Upper Peninsula. As you can see in this map, we launched in Clare County and Lake County, Roscommon County, Gladwin County, these rural northern Michigan counties that have lots of challenges of rural poverty. And then in 2026, we've been expanding to many more communities, and I'll share kind of how that has happened. Soon we're expanding to other states, so Michigan should be proud of birthing this incredible plug-and-play program that has amazing outcomes, that is going to many other states that are also looking to solve several problems. Yesterday, we actually expanded to 7 more communities. We expanded to the city of Jackson and Blackman Charter Township. We went to Kalamazoo County. We're expanded in 3 more communities in Kalamazoo County. And we ended the day yesterday in Muskegon and Muskegon Heights, where we launched the program. So how have we been able to expand? It's a plug-and-play program. It is, there's one standard application, there's one standard verification process, one payment path used in every community. It was built to be efficient by design. The program is led by Michigan State University College of Human Medicine. University of Michigan Poverty Solutions is a founding partner. Give Directly is the administrator. They handle the secure, verified payment delivery. In every community that we're in, we have local community champions, municipalities, nonprofits, health departments that lead engagement and outreach. And then our funding has also made expansion possible. It's a public-private partnership, and I'll share a little bit more about that. I want to talk a little bit about Give Directly, the cash administrator. They are the nonprofit, the leader in safe and secure cash transfer delivery. As a pediatrician, I know what kids need. I know how to take care of kids. I'm not the expert on how to get people cash. So we wanted to make sure we worked with the leaders in this field, folks who only do this work and do it well. So they provide rigorous, already built processes for identity verification, payment delivery, fraud detection, and program integrity. They have local staff in our Michigan communities that handle enrollment, verification, and participant support. They have delivered over $1 billion, and that's with a B, to over 2 million people, and this work has really gotten them many, many accolades. I want to kind of walk you through the application process. So folks apply online at rxkids.org. It is a simple application. It takes about 20 to 30 minutes. Most people actually apply on their phone. There's real-time feedback that is offered to families so that they can complete the application accurately. Moms have to submit documents in their application. For example, identity documents, a driver's license, a passport. They have to submit residency verification, utility bills, landlord rent agreements, deeds, and they have to submit pregnancy verification. This is a sample of that screenshot of what it looks like to submit the pregnancy verification. They have to submit, for example, an ultrasound or an after-visit summary, something from their OB-GYN. And it says there's a note here, and this note is in the application at multiple times. Any application received, including fraudulent, forged, purchase documents, will be automatically rejected. Participants also have to sign multiple times throughout this document that what they're submitting is legitimate. I'm going to walk you through the process of what happens after folks apply. So there's a signed application. They submit these necessary documents, multiple necessary documents of identification, residency, pregnancy, or birth. They have to also sign an attestation that these funds will not be used for any illegal or fraudulent purposes. That goes through a rigorous screening process with both an automated and a manual review. Real people are reviewing every single application. We look for any kind of IP signals issues that would raise any concerns, any behavioral signals that would raise concerns. Then those applications are automatically flagged and investigated by an internal firewall team. We cross every applicant, every name through a sanctions list to make sure that no participant that's on any kind of list of illegal folks or drug trafficked folks or any other sanctions, so they're not a part of the program. They go through verification through trained reviewers. From every community that we're in, we have sample documents. So we know what ultrasounds look like in Ontonagon County in the Upper Peninsula. So in every community, we know what medical documents look like. We have those samples and we verify them with what participants submit. We also have a weekly data feed from the health department, so with birth certificates. We know every baby that's born in every community. We get a weekly feed, and we're able to double check all those births. And no payments are delivered after birth until we have verification that a baby has been born. The approval process, we have, once again, a firewalled anti-fraud team that resolves any flags. Payments are paused if there's any concern. There's an investigation that's done before anything is released. Folks get their payments, by and large, through a direct deposit to a checking account. 80% of participants choose a direct deposit, or some people choose a reloadable debit card. There's no middleman. That's part of the leanness of this operation. We have monitoring that happens after folks are approved. There's mandatory post-payment surveys. Folks must complete a survey after every single payment to make sure that they got their dollars, that the mother is safe. And if those are not completed, payments are paused until that's completed. So once again, we work with, this is led by MSU, administered by Give Directly, but we work with dozens of community partners across the state. This is just a sample of some of them. For example, in the Upper Peninsula, we work with all the health departments. Yesterday we were in Muskegon, and it was the city of Muskegon that was the community champion. So it's a local entity on the ground that also helps implement the program in terms of outreach and engagement. All right, so we also have lots of funding for this program. It is a public-private partnership, and that's one of the beautiful parts of this program is that all kinds of folks have come alongside believing in supporting our mamas and babies. So in your packet that you have, there's a lot of things in your packet, but one of those things in your packet is every single funder that has come in to support the program. And to date, we have had 150 grants, and we have raised over $86 million. This is non-state money. $86 million has come in from philanthropy, from corporations, from healthcare, from individual donors. Every single one of those grants has its own contracting, its own reporting, and its own audit requirements. So lots of other funds, lots of other funders, place-based funders, national funders, state funders have also come in to support this program. The fact that this is a public-private partnership and the fact that it's administered by a nonprofit also allows us to protect public benefits. So what does that mean? It means that these dollars are considered a gift and not income, and it does not kick people off important benefits like WIC and Medicaid and SNAP. So that is also a critical design element to include philanthropy and the nonprofit administration to protect public benefits. So those are all the dollars that have come in from non-state sources. Now I'm going to walk through all the dollars that have come from the state. So as I shared earlier, in the first budget where we received money was in fiscal year 2024. So we've been part of a bipartisan budget for the last 3 years. So in fiscal year 2024, we received money from TANF just for that Flint proof of concept. That was $16.5 million. That was a work project for 5 years of TANF funding. Then in fiscal year 2025, we received $20 million, and that was also in TANF funds. Remember those federal block grant dollars intended for poor families, and that was to expand the program to outside of Flint. And then in fiscal year 2026, we received another $20 million to continue that expansion. This is considered annual ongoing funding, also in TANF funding. And then in fiscal year 2026, we also received Healthy Michigan funds, $250 million to support the program over 3 birth years. So in total, what has been appropriated from the state of Michigan is a little over $300 million. The annual TANF funds, coupled with the Healthy Michigan funds over 3 years, in addition to those private dollars, which I shared earlier, allow us to reach about 30,000 babies per year over the next 3 years. So this is 3 years of funding, 3 years of support that allow us to reach, once again, about 30,000 babies. And for reference, we have about 100,000 babies born in Michigan every year. However, as you likely know, we lost some of that funding. The fiscal year 2025, our fiscal year 2025 work project was canceled. So we lost about $15 million. So that's about 5,000 less babies that are able to be part of this program because of those canceled funds. That means we can't expand to as many places as we'd like to that want the program because of those canceled funds. So where do those state funds go? 85% of every state dollar goes directly into the hands of families. 85% of every state dollar goes directly into the hands of families. So what is that other 15%? 15% is all the other administration. It is the robust eligibility verification, the customer service, the cash delivery, the payment operations, the fraud prevention, the auditing, the oversight, the technology, the data security, the reporting, the communications, the marketing, the staff, the program management, and the overhead of every organization that's involved in this program. 15% goes to making this program happen, and 85%, once again, goes directly into the hands of every mom and family. All right, so now I want to talk about how each person is funded. And I know this question has come up, and I've tried to answer it multiple times. I'm going to try to answer it again as clearly as possible. So how is each enrollment funded? So if a mother and a baby is on Medicaid, we can use TANF funds. Remember, we use TANF for low-income people. TANF is that federal program that has lots of restrictions. We are using Medicaid as that proxy for low income. So if a mom or a baby is on Medicaid, and we're not asking families if they're on Medicaid, we are doing a high-integrity data match with Medicaid to make sure that they're really on Medicaid. If a mom is on Medicaid, they are funded with TANF dollars. So the program provides, once again, $1,500 prenatally and then $500 a month. Most of our sites, the program is until 6 months. In some of our communities, the program goes until 12 months. So we're able to use TANF funds for 4 payments if the person is on Medicaid. You cannot be on Medicaid if you do not have legal status. So there are rules in Medicaid, there are TANF rules that make sure that you are a legal resident. So anybody on Medicaid who is on Medicaid, we use TANF funds. We also use the Healthy Michigan funds, and we use private dollars. Once again, you have to be a legal resident to be on Medicaid. If a person is not on Medicaid, but they have submitted identification that confers legal status, we use the Healthy Michigan funds. So what are those identifications? So if a mom submits an application and she submits a driver's license, a Michigan driver's license, a state ID, a U.S. birth certificate, a U.S. passport, a certificate of naturalization, a certificate of U.S. citizen, military ID, tribal ID, a concealed carry license, all of these IDs are only allowable if you have legal status. You cannot get any of these IDs if you do not have legal status. So if a mom submits her identity verification with any of these documents, we then are able to use Healthy Michigan funds, but we also use the private dollars, once again, because it's a public-private partnership. For every other mother and baby that is not on Medicaid, that does not submit identification, that confers legal status, we fully fund those babies through philanthropy. So I'm going to reiterate what I've read multiple times, that no state funds go to undocumented immigrants. None. We comply with all federal TANF Medicaid rules, and we do not afford these dollars to anybody who does not submit identification that does not confer legal status. All right, now I'm going to talk through our layers and layers of safeguards. And they include eligibility verification, fraud screening, financial controls, audit and oversight, and data security. So in terms of eligibility verification and fraud prevention, as I shared earlier, identity, residency, pregnancy, all is verified with multiple documents. Lots and lots of documents are required. We also, once again, get samples from communities, so we know what kind of documents are in those communities. We do IP flagging. We monitor behavior on technology signals. There's human and automated reviews. There's multiple warnings throughout the application that fraudulent applications will be rejected. We have an anti-fraud attestation. We get weekly birth certificate feeds from the state verifying childbirth before any postnatal payments go out. And then we also have self-reported data when we compare those to third-party sources. In terms of financial controls, we invoice TANF only after high-integrity third-party Medicaid data match. We comply with every federal eligibility requirement, including legal status. We use direct deposits or reloadable debit cards. Funds are only dispersed only to verified accounts in a recipient's legal name. We have mandatory post-payment surveys, and payments stop if they're not completed. We have a monthly reconciliation between Give Directly disbursement records and the MSU general ledger. There is no mixing of state and philanthropic funds. They're separate accounts, separate ledgers, separate audit trails. We have layers of audit and oversight. MSU is a massive research institution. We have hundreds of millions of dollars in sponsored research and grants. This is what we do. We manage big grants. We have routine programmatic and financial reports that get submitted to MDHHS. We have a single audit that is submitted to MDHHS, and that is published online. Every invoice is reviewed multiple times at the department level, the college level, contract and grants level, and MSU accounting. We have monthly accuracy and compliance reviews of all awards. MSU monitors Give Directly. Give Directly is the subrecipient routinely. And MSU just completed an audit of Give Directly, a review of invoicing in April of 2026, and found no comments and no findings. Give Directly also on their own completes a single audit by external auditors. They have continuous improvement plans. They have a schedule of federal awards that they report annually. They have an internal audit. In addition, we have a dedicated ARCS Kids internal audit associate that focuses just on auditing and oversight. Oops. Something stopped here. I will get this back on. Here we go. We can all pause to look at the cute babies while I'm getting this back on. All right, data security. We have lots of processes in place to protect data, protect privacy, secure collection of storage and participant data, encryption of sensitive personal information, secure authentication methods, role-based access of who can view data, multiple data use agreements governing data sharing and data access, and secured transfer of data when needed. So that's a lot about what the program is, the multiple safeguards in the place regarding the program. And I want to end, when really this should have been the beginning, I want to end with the outcomes, what we've learned. We have a dashboard that updates every single week. So in the spirit of full transparency, every single week you can see how many dollars have gone out the door to how many families in what communities. For example, Chippewa County, $1.26 million has gone out to 367 families in Chippewa County. This updates every week right now, but we are upgrading this dashboard, and it is soon going to upgrade every single day. So every single day, you'll be able to see where the dollars have gone and to how many families. What we have learned is that we have more stable families. We are at a near 100% take-up rate, which is pretty phenomenal, especially in our communities where we've been in the longest. We just completed a survey we just got this data on Friday from 3,000 mamas, and we've had multiple surveys of our mamas where we ask what they spend their money on, and this is really consistent with child allowance literature across the country and across the world, and 94% of families say that they spend this money on baby supplies. First of all, top of things is baby supplies, and when you break out baby supplies, it's diapers. That's the most common thing that folks spend their money on. Then it's food and utilities. We also have learned from families that 84% of mamas say that this is helping them make ends meet. In research that has been published in the American Journal of Public Health, we are seeing significant housing stability, a 90% drop in evictions in Flint. Families are able to pay rent. There's less hunger, improved nutrition security. Also in published research, we're seeing improvements in maternal mental health. Mom is repeatedly saying that I can breathe, I feel a weight's been lifted off my shoulder, that I'm less stressed, that I can be present, reductions in postpartum depression and anxiety, and improvements in maternal well-being, feeling more hopeful, respected, and valued. All right, and these are the money slides. This is research that was published in JAMA Network Open that shows a population-level improvements in prenatal care use. Access to health care. This was published last week in Lancet Public Health. It made national news. So thank you to all of you, because we have healthier babies. And that was always the goal. We have population-level healthier babies. An 18% decrease in premature babies, a 27% decrease in low birth weight babies, and a 29% decrease in NICU admissions. This is for an entire city. And then I'm going to share something which I have not shared yet publicly. Because of these findings, we are also seeing more babies alive. We actually are starting to look at our neonatal infant mortality numbers. Neonatal mortality is death within the first month of life, and it's largely related to premature deliveries and low birth weight babies. And what we are seeing preliminarily is a 45% decrease in neonatal mortality. There are babies alive today because of your support. That babies are alive because of this program, because we have less premature babies, we have less low birth weight babies, and we have thus more babies that are surviving after being born. This is a big deal. I honestly get choked up. This was the goal of the program. It's a maternal infant health program, and it is working. Our next impact is around CPS involvement. So we spend a lot of money on child welfare. This is really traumatic for families. The peak age of child welfare involvement is the first year of life. It's more than double any other year, and it's largely around because of the economic instability of that window. After ARC's kids started in Flint, we saw a 32% reduction in involvement in the CPS system. 32% decrease in infant allegations. This was published a few weeks ago in JAMA Pediatrics. So this is why it's so important to do something for a whole community, because you can make a whole community impact. Flint's rate was about 22%. The state of Michigan rate was about 10%. And you see that disparity narrow. Flint gets down to about 15%, still higher than the state rate, but it's finally decreasing at a population level. That's less babies getting involved in the CPS system. Less babies maybe that have to go into foster care that we have to support until they're 18 years of age. Lastly, I want to share that all of these findings, the prevention of NICU visits, the prevention of child welfare involvement, all these things save money. So in our economic analysis, there's a return of $1.90 for every dollar invested in the program, and that's just cost savings. There's cost savings, but there's also economic stimulus. These dollars that are going into the hands of families are being spent locally and quickly. They're supporting small businesses. They're being spent in grocery stores and child care centers with landlords. That's creating downstream jobs. Hundreds of jobs are being created. A report from the Upjohn Institute modeled that, as well as an economic multiplier. I am going to stop talking. I have talked a lot. I just want to reiterate that this is a program that is working. It is serving thousands of Michigan families from the tips of the Upper Peninsula to Flint to Berrien County. It is built with multiple safeguards. We have a tight stewardship of state dollars. It's improving outcomes that matter, maternal infant health, family stability, child welfare. And once again, it's a public-private partnership. It's state dollars, but also we've been able to bring in lots of other dollars to make this program possible. So I want to end once again by thanking you all for making this work possible. And I look forward to your questions.
Thank you, Dr. Mona. Appreciate that. Appreciate the information. Appreciate the brevity of a large slide presentation as well. So I guess my first question is, we're looking at this, from what our role is, which is the critical eye of the allocators, if you will. Where do you see this going? Like, what's the long-term, strategy for this program? Where's it headed? What do you want to see? What's your long-term desires, I guess, would be?
Yeah, that's a great question. Thank you. We expanded in 7 places yesterday. In July, we're expanding to parts of Calhoun County and Grand Rapids. In August, we have a few more expansions. And then we're pretty much spent down. We have all our state funds committed after those expansions. Unless we have, if the clawback dollars are restored, but I think those are gone, or if uptake is not at 100% in certain communities, there may be some more funds for us to expand. But pretty much based on the state funds that have been committed, that combination of annual TANF, the Healthy Michigan funds, we have done what the legislature has asked, and we are pretty much at our, we don't have any more dollars to expand. If there was any more dollars at the table, we're ready to go. However, I mentioned earlier, this is no longer just a Michigan story. So we have funds committed in many other states that are about to launch the program. States like Ohio and Mississippi and Texas, who are also looking for solutions to a lot of the crises that they're facing.
I mean, I can appreciate that, but I guess really what the basis of my question is we have to look at the structure of government and the spending of government from a critical perspective. And I've watched lots of social welfare programs expand and expand and expand and get bigger and bigger with really not a lot of downstream results. We're trying to eradicate poverty, those kinds of things. So really more specifically, my question to you is like, what you as a person, what's your long-term vision for this program? Like, what do you want to see it become? Do you have an answer to that?
Yeah, so this program was really inspired by the expanded child tax credit. So in 2021, during COVID, we became like peer countries, and we expanded the child tax credit, and millions of families got unconditional monthly child allowances. And that dropped child poverty to the lowest level ever. It cut it in half, and incredible outcomes happened. Improved family stability, less debt, less child abuse and neglect, improved health. And then by one vote in the U.S. Senate that wasn't renewed, and millions of kids went back into poverty. So after the expanded child tax credit, about 12 states adopted their own state-level child tax credit, which provides child allowances up until 18 years of age. And I think of this as a tiny, tiny, itsy-bitsy version of the program because it's only supporting pregnant mamas and babies. It's not doing what a dozen other states are doing, which is providing support for all of childhood. So what I would like to see is ongoing, continuation of just this tiny version of this program. I'm not advocating for a full child, tax credit program which supports kids until 18. I'm just advocating for supporting families during this most vulnerable time where we have significant evidence that this is working. It's stabilizing families, it is saving money, and it's putting money back into local communities.
So I guess, we do our homework, we do our research, we look into these projects, we look into these expenditures. But remember the side we're coming from. We're coming from the allocation side, right? And the funding side, the sustainability side, and the long-term potential liability, right, for the state of Michigan as the taxpayers. And so as I looked through your website, getting ready for the meeting, I came across comments and positions that they gave me pause when I listened to what was being said with regard to, what does this program, what's the desires of Dr. Mona long term, right? And I pulled a video off your website, and I'd love to have you comment on it. I think it's video 1, if we can.
Have policies in place. We all saw when we failed to renew the child tax franchise. We don't do. So we're going to start with babies because once again, these pregnant moms and babies, this is the most important time. But our goal is that this is just the beginning and that we expand from babies.
And then there's a video too that subsequently comes after.
The financial drop-off when families don't receive the monthly allotment after 6 or 12 months. So in several of our communities now, we have graduates. We have graduates in Flint, we have graduates in the UP, where it's the 5 counties in the UP, where it's in the 6-month program. We have done a lot of priming of participants in terms of the offboarding process, so they know when it's ending. And then we've also done some follow-up kind of surveys and research about how they're doing afterwards. I wish we could extend this for as long as possible. I wish we could be a child allowance program up until the age of 18, like other countries, like the expanded child tax credit. I wish we could be longer. Unfortunately, it's only either 6 months or 12 months. But part of our ongoing advocacy is to get this to be a statewide program and to extend it for as long as possible.
So, from watching that, as I did my research, it sounds to me that they're long-term for a payment plan to parents with children up to the age of 18 years old.
Yeah, I think that's like a federal goal. Then there's a lot of federal work that's happening right now to renew the expanded child tax credit. It would be amazing if we were a state that supported children and families as long as possible. But a place to start, which is what we're doing, is this maternal infant period.
Mm-hmm. Okay, I appreciate that. Representative Schreiber.
Thank you, Mr. Chair. Is there anything in terms of your framework that would prevent pregnant mothers from taking the money and then getting an abortion at 25 weeks?
That's a great question. What we are seeing actually is a decrease in abortions. So we in Flint, after the program started, we actually saw more babies being born. The number one reason that people have an abortion is because of finances, because it's expensive to have a baby.
So is there anything in the framework that prevents pregnant mothers from taking the money and then getting an abortion?
There is nothing in the framework that does that, but it's highly unlikely to have an abortion at that time.
How many abortions have occurred from mothers who have taken the money?
We do not have abortion data. Nobody has abortion data right now. That data was stopped being collected in 2024.
So you just don't know?
No.
Okay. Do mothers who are participating in this program know that you are tracking their voting habits?
We are not tracking voting habits.
Oh, well, what about Vote ER?
What about Vote ER?
Well, you promote Vote ER on your state and national resources page, and this is encouraging mothers to vote. It's monitoring whether they vote or don't vote. And so, can you explain your relationship with this organization?
So on our website, we have resources for every community about different things that they may want to sign up for, be it WIC or United Way Services. And the Vote ER is one of the resources that folks can sign up for if they want to register to vote. There is there's something called a childbirth voting penalty that moms who've recently had a baby are less likely to vote. So in the spirit of improving civic engagement, we have added that as a resource for families.
So just going back a minute, you said that you don't monitor whether or not mothers who participate in this program vote or not, but you issued a white paper studying the effect of RX Kids, and in that white paper it says RX Kids enrolled moms were more likely to vote than their counterparts. How would you be able to issue that statement when you don't monitor their voting habits?
So that study was conducted by an MSU political science professor, and that was because in our research, we noticed that RX Kids mothers, compared to mothers in other communities, actually had more trust in government and more trust in healthcare after the program started. In all of our communities, we really try to remind families that this is brought to you partially by government. We celebrate our local, municipal, state legislators at every launch. So we want to remind folks that this is coming from government. And because of that, we are seeing more trust in government, which I think is a good thing, right? And so a MSU political science professor decided to look into the research to see whether that trust in government translates into more voter participation, because once again, voter participation diminishes around the time of having a baby. All of the financial, the time constraints of having a newborn, people don't vote as much when they have a baby.
So I'm just getting some mixed signals. So are you or are you not studying the voting habits of moms enrolled in the program?
An MSU political science professor did do that research and studied the voting habits.
Okay. And who's paying for that?
Nobody paid for that.
Nobody?
That was an academic who was interested in this research.
Okay. Thanks.
Representative Regas.
Thank you, Mr. Chair. Thank you for your presentation. We really appreciate you being here today to answer some of these questions. I do have 2 questions, if you could allow that, Mr. Chair. So when I look at, and just to give you some of my background, yes, I'm a legislator. I'm for accountability and oversight, but excuse me, I may have maybe a unique perspective, because as a young mother, I actually have participated in some of these programs myself. So I know what it's like to be on the receiving end of some of these programs. So we currently have 16 programs to help moms and needy families here in Michigan, such as the Michigan Independence Program, State Disability Insurance, the SNAP Program, Medicaid, My Child, Healthy Michigan Plan, Maternal Infant Health Program, Child Development and Care Program, Head Start, Early Head Start, Low Income Home Energy Assistant Program, State Emergency Relief, Children's Special Health Care Services, Refugee Assistance Program, Nurse Family Partnership, Healthy Families America, and Parents as Teachers. So with that being said, why is your program different? And from the information that I have here, with the state programs, we actually monitor certain purchases are allowed, are not allowed. Under your program, do you monitor how the funds are actually spent, or do you rely on the parent answered survey? How do you ensure that the funds are actually helping the babies, or are these funds able to be spent on items such as alcohol, weed, flat screen TVs, those that actually don't benefit the child? How do you monitor?
Yeah, thank you. So as a pediatrician, I'm familiar with a lot of those programs. I refer my patients to things like Nurse Family Partnership and the Maternal Infant Health Program. And they all have different benefits. They all have different eligibility and different outcomes. And I think something that really sets this program apart is its flexibility to meet families with the needs that they deem are the greatest. And also, for example, WIC, which is a really important nutrition program for moms and babies. WIC only has about a 50% take-up rate. Only 50% of the folks that are eligible for WIC actually participate in WIC. And it only provides nutrition support. Home visiting programs like Nurse Family Partnership only have about a 20 to 30% take-up.
But what about your program? Yeah, I mentioned these programs. We don't need to go into these programs.
Right.
We're here talking with you in
Right.
this program, and so my first question was, do you actually monitor the purchases, or are parents able to spend these funds, some of these taxpayer funds, on alcohol, weed, televisions? That's the actual question that I need you to answer.
So this is a program built on trusting women, trusting mothers, trusting families to best meet their needs. And this is how the child tax credit is based. This is how Social Security is. We're not asking seniors who get Social Security what they're spending their funds on.
That's a little different. They actually paid into
Well, the child allowances, once again, the expanded child tax credit, the global recommendation is to trust families. And we would not be seeing the outcomes that we're seeing without knowing that families are spending this to meet needs. We're seeing a 90% reduction in evictions. We know that it's going to help families pay rent and get more stable housing. We're seeing these incredible birth outcomes. We know that's helping families get the care that they need and go to prenatal care, get proper nutrition. So in multiple surveys, not just from this program, but very similar programs, we know what families are spending the money. But no, we do not do monitoring. If we did monitoring, it would be a much more expensive program to administer, but it would also send a really different message, telling families that no, we don't trust you, we think government should be in your life, and to monitor what you're doing.
So the answer is yes. I think that long-winded answer is yes, that parents could spend these funds on alcohol and weed and TVs then?
That's not what we're seeing in the data, and that's not what we're seeing in the outcome.
That's not what you're saying in the survey, that there's no proof. So I think your answer is yes then. I think that's what you're trying to explain here. My second question is, could you explain the ESP Economic Security project? Specifically, I'm looking at this details of this project here. So they exclusively donate to Democrats, as proof on the Open Secrets website actually lists that. And also, could you explain a little bit about how ESP Action has worked with groups like Community Change and other, like the chair had shared that brief video, to push Congress to permanently expand the child tax credit, and also the Michigan Rescue Plan, opening up to illegal immigrants by no longer requiring Social Security numbers to apply. Could you explain that?
I'm not familiar with the Michigan Rescue Plan. I don't know what that is, but ESP Economic Security Project is their representatives are members of our external advisory board. So RX Kids has an advisory board that's full of funders and friends who we meet with about twice a year virtually, who just kind of inform the program, and we give them updates. So they're a member of our advisory board. That's it.
Okay, so ESP Action has actually worked under the American Rescue Plan to open it up to illegal immigrants by no longer requiring.
They're not part of ARC's Kids. They're a member of our advisory board. They don't have any direction or oversight or get paid or anything else.
Okay, but they are affiliated.
They're a member of our external advisory board as well.
I'm sorry.
Yeah, thank you.
What's the purpose of the advisory board?
Just to listen, to gain insight, to give funders, for example, research information, to talk, just an opportunity to hear from folks who might advise us on this work, just like many other organizations have advisory boards.
Has ESP donated any philanthropical dollars to ARC's Kids?
They funded a mural that is in downtown Flint.
So they've not funded ARC's Kids,
No.
anything to ARC's Kids,
No.
but they're on the advisory board. Actually, how many, 2 or 3 individuals?
I think 1 or 2 people.
1 or 2. Mike, would you run video 8, please?
Thank you.
Guaranteed income. Y'all, the fights against guaranteed income actually give me hope because of the fact that they recognize that we are a powerful movement not to be messed with and that we are going to win these guarantees for all of us. So the fact that we have made enough noise that people feel like they got to pass bills in order to not have it within their states or their cities, I am so excited about that. I'm like, yes, let's go. Give me something else to work on. Yes.
What's the saying? They laugh, they ignore you, then they laugh at you, and they fight you. But then what?
You win. So there we go. So we're at the fight phase. So I'm like, yes, bring on the fight. Winning's right around the corner. And when we win, I retire. So that's what gives me hope.
Are any of those members affiliated with ESP?
The woman on the right was the former maybe chair of ESP, and Aisha, I think she's a friend of ESP, but this has nothing to do with ARC's Kids.
No, but it demonstrates the individuals that are on your advisory board. And in your own testimony, you said that they didn't give any philanthropic dollars to ARC's Kids.
Correct.
But so I'm trying to understand how they end up on your advisory board. What's the motivation?
They are national leaders in cash transfers. So they
tell me what cash transfers are.
Cash transfers are, for example, advocating for expanded child tax credits.
Could they be a guaranteed basic income?
So I'm thank you for that. So this, and you mentioned this in my introduction. This is not a guaranteed income program. So guaranteed.
My question was: could it be?
It could be, but this is.
Do they advocate for it?
I think they do. We don't. We have nothing to do with guaranteed income.
So what would be the reason that ESP would be on your advisory board?
They were excited about this program. They asked to be on the advisory board. They saw it as, and we welcomed their input.
And what's their excitement based in?
This is the nation's first community-wide cash transfer program for moms and babies, and it's working.
Representative Carr.
Thank you, Mr. Chair, and thank you, Dr. Mona, for being here. I do have 7 questions, but I think they'll be fairly quick. My first one is, how is a community chosen? I know there's about 60 or so in Michigan, but does the board of a local community have to ask for it? Do you make the decision? How is that determined?
That's a great question. We had an open application process for communities to be part of ARC's Kids. We had a selection advisory made up of entities that really have a kind of the pulse of the whole state. There was 3 selection criteria. A community had to be high need, so it had to have some sort of issue, high poverty rates, high Medicaid birth rates, closing of maternal hospitals like in the UP. So the community had to be high need. They had to have a local community champion. The community had to want it, so there had to be an entity that applied and said, hey, we want to bring this to our community, and they had to have the match funds, those other funds to make it possible. So those were the 3 criteria where communities were selected. We had dozens of communities apply. We were not able, more demand than we had state funds allowed before.
Okay, good. And then who at ARC's Kids makes the final determination? Is it you who does it, the board?
Yeah, no. So the selection advisory committee really informed that decision.
Okay, thank you. And my next question is, you said 85% of the state dollars go directly to the babies, 15% for overhead.
No, it's not overhead. It's all the administration. It's administration and overhead.
Okay, sure.
Sure.
But 85% goes
Yes.
to the babies from the state funds.
Yes.
Is that the same for the non-state
Pretty
funds?
much, yes.
Okay. That was it for my second question.
Thank you.
My third question is, you said that no state funds go to illegal immigrants. But again, you said state funds. So you have the philanthropic dollars that come in as well. Do any philanthropic dollars go to illegal immigrants?
Yes.
Okay, thank you. My next question is already asked by Representative Shriver, but I do want to just ask you it one more time. I appreciate that RX Kids sees the fact that there's a life in the womb and recognizes that value, starting at 16 weeks, so that the woman is eligible at 16 weeks gestation. My question would be very similar, is if a woman is eligible, she gets that money when? Within a matter of weeks, maybe 17, 18, 19 weeks along, she gets that, and then at 24, 25 weeks, if she decides she wants to have an abortion, she's already gotten money from RX Kids. Is that a possible reality?
It's possible, but it is very unlikely to have a termination at that time. In your packet, there's also, I just want to read you this.
Would you claw back money if that happens?
Nobody gets money if they don't verify that a baby has been born. So
they don't get the money until the baby is born.
No, they get the money prenatally, but then the rest of the money comes after birth.
So you halt the money once an abortion happens, but they still would have gotten maybe $2,500, $3,000 while they were pregnant.
No, you only get $1,500 in pregnancy.
Plus $500 a month.
Right, but you don't get the monthly money unless there's verification of
Well, you
childbirth.
still get the $1,500.
You get the $1,500, yes.
And then if you have an abortion afterward, you still got that $1,500.
Yes, which really exceeds, the cost of abortion, I think, exceeds $1,500.
Is that what they're paying out of pocket for an abortion?
I don't know, but I want to share very quickly what a mom in the UP said, and this is in your packets. Thank you so much. Welcoming a new baby is a joy, and having some extra money to get us started with our little guy was so helpful. I have told pregnant friends about the program, and we all agree it is such an incredible gift. I think moms in need can make the decision to keep their baby with this help. It is such a great program. That is what we consistently hear, is that this is preventing abortions, and that is what we are seeing in the data.
Okay, my next question is, what is your salary at MSU, and then also what is your salary if you have anything on top from RX Kids?
I work for a public university. That salary is publicly available. It's around $380,000. There is no additional salary because of my involvement in RX Kids.
Okay. So is this one of your expectations as being an employee?
Yeah, professor, a
Sure.
pediatrician.
Yep.
This is part of my job. Nothing changes.
Understandable. With that, someone said that one of the ones you quoted, one of the ladies said, "Your generosity means more than I can say." You have a $380,000 salary. That's a pretty good chunk of change you're getting there. How much have you donated to RX Kids?
I have donated a significant amount over the last decade to Flint kids and Flint families. Helped start multiple funds for children. So I happy.
Your personal money you have donated yourself.
Of course, I have.
Okay. Probably pretty easy to do with $380,000.
Everybody else can donate on rxkids.org.
Representative Carr, we are trying to get everybody in, so I don't know how many you have left there, but
Like one.
One, please be brief. Thank you.
Yeah, so my last question is that economic analysis. For every dollar that is given out in RX Kids, it generates $1.6 to $4 in economic activity. What type of economic analysis was done by the Upjohn Institute to determine that?
There's a flyer here in your packet about that economic analysis. It links to a robust report with multiple formulas and graphs. They use two different economic analysis, the one that the Bartik analysis and some other analysis, but it was really it was robust, well considered in the world of macroeconomics, which shows this stimulus effect. There was also another analysis done by the Genesee Group, the Genesee Chamber, which also showed a similar economic stimulus effect.
Okay, my last thing here is you said that government in your life and what you're doing is something that you're trying to not have happen in terms of micromanaging where the woman is spending the money and just like overlording her with the resources. I guess my thought is when you compel other taxpayers to fund these taxpayer-funded programs, you're micromanaging and dictating how we decide to be charitable with our money. It's not our decision. We're forced to help other people instead of voluntarily choosing to. So I hope that we can apply that same level of not micromanaging people's lives, that you're not telling the women what they do with that money, that you're not telling us what we do with our generosity, because you're forcing us to with taxpayer resources going to these programs. So I hope you'll be mindful of both ends of the equation. Thank you.
Thank you.
There was one thing that was mentioned there that, interest a little bit, and it is the concept of, I think Representative Carr asked about that bottom line of funding to all the other individuals that get funding that was all purple. And I think there was a question about, is there a potential that, illegal immigrants in this country are getting funded? And I think the answer was that was, if that occurs, that's all being done through philanthropic dollars. It's not being done through taxpayer dollars. Is that
correct?
Okay, so the issue perhaps that I find that to be potentially disingenuous is that when you look at your philanthropic dollars, the city of Dearborn, additionally the city of Dearborn through a congressional allocation from Senator Peters, tax dollars, the city of Detroit, the city of Flint through a congressional allocation from Senator Peters, tax dollars, the city of Jackson.
We're not using municipal dollars for that. It's only philanthropic dollars that are going to support.
But in your philanthropic list, you list municipalities and
right.
that they're sending you money. Is that true?
But municipalities do provide support for ARCS kids, but we're not using municipal money for for folks with no legal status. We're only using philanthropic dollars.
But it's on your philanthropic list.
Right. I apologize, and maybe I should have made a separate list of philanthropy and municipalities. But the folks that are funded in the bottom purple line that are not Medicaid, that don't have ID that confers legal status, are funded by philanthropy only, not
so
municipalities.
You actually have the philanthropic dollars that have come from municipalities segregated out in its own separate line expense?
Yes, so every community has its own also philanthropic funding, in addition to maybe some municipal funding. Only philanthropic funding, not any taxpayer dollars from any level of government is supporting undocumented immigrants.
Okay. Well, I find it's interesting because it's on your philanthropic list.
That's just all our other money, our non-state money.
I appreciate that. Yeah, I appreciate that. Representative Bierlein.
Thank you, Mr. Chair. I do have a couple, and they're not necessarily all related. I'll start with the first one. So I'm also on the Health Policy Committee. We just heard last week about, or 2 weeks ago now, the need for education at the prenatal level because fetal alcohol syndrome is still such an ongoing issue. Are there any education requirement? Do you require prenatal care with cash payment? I mean, there's some level of proof required to prove pregnancy.
Yes.
But after that point, is there any requirements for what kind of prenatal care a mother is receiving?
So you're right. So we have to have medical documentation that proves pregnancy. So it has to be an ultrasound or an after visit summary from a doctor's office. So we are pushing people to prenatal care. And I'm putting this graph back up. This was research that was published in shows that mamas are going to prenatal care earlier and more often, so we have a significant increase in prenatal care. So we are not, they have to go to prenatal care to qualify in pregnancy, and then we are seeing significant improvements in prenatal care utilization.
Okay. Second question had to do with back to your bar of where the dollars go, if it's TANF or non-TANF dollars. In the places that qualify, in the communities that have been selected, there's a recognition of need for whatever that need base is, whether it's poverty or health outcomes. But there are still populations within those areas, like the city of Detroit. There are populations of very, very wealthy people. Do they qualify for that second bar, no matter what their income is?
So they don't have to apply. This is a voluntary program. But once again, if we're going to treat an entire community and treat those disparities, it is for everybody in those communities. So yes. But by and large, over 80% of every participant in this program makes less than $50,000 a year, and that's up on our website.
And then I know there's a lot of other people who want to ask questions, so I'll just get one more. It has to do with, so all of the data that we're receiving is research that you've conducted. There's some other folks who have conducted similar research that are presenting different outcomes. So there was a I had baby's first year study.
Oh, thank you for this.
Can you comment on that? They came up with different outcomes than you did after a 3-year period of measuring it.
Thank you so much for this question. So Baby First Years is a study of postnatal payments. They didn't give payments in pregnancy. They started after birth, only for about 400 families, and they were giving families $333. This study also occurred during COVID, when there was an infusion of cash in the economy, as well as some detriments to child development, obviously. And so they have some null findings, which means they did not see some impacts on certain things. This is not, ARCS Kids is very different from Baby's First Years, and we have really learned from them, and that's why we're really better than them. I'll share the 3 main differences between ARCS Kids and Baby First Years. The prenatal cash. The fact that we are giving prenatal cash is why we are seeing improvements in prenatal care, why we are seeing improvements in family stability, why we are seeing those birth improvements. So that's one of the big differences. We start prenatally, they don't. The second big difference is the dose. Their program is widely recognized as being underdosed. They didn't give families enough cash. They gave $300. Ours was adjusted to inflation and science at $500. That's the second big difference. The third big difference is it happened during COVID. So their research, their trial happened during this unprecedented time, where once again there was a lot of other cash that went into families' homes, and other impacts. And then lastly, scale. ARCS Kids is for entire communities. They means tested individuals, and it was a very small sample size, about 400 people, and we're already operating at scale at over 12,000 people. We actually have a document on our website that explains the differences between these 2 studies, but we're in touch with those investigators. We've learned from them, but they're very, very different, and that's why we're seeing better outcomes than they did.
Researcher Joe Ryan, who disagrees with your findings, can you address that at all?
Yeah, so Joe Ryan is a researcher in child welfare, and they also looked at the same child welfare data that we had. They also saw a significant decrease in child welfare analysis, but they used different methodology to kind of infer the statistical significance, and we feel that their methodology was flawed. Our paper was just published in JAMA Pediatrics. It went through that rigorous peer review process, and we actually also have a paper online about kind of the differences in the methods. But once again, we both saw significant decreases in state-level child welfare involvement because of some flawed methodology based on kind of the sample sizes. They did not see statistical significance, whereas we did.
Did we not ask you for that data that study was based on?
Yep, you have all that data. You have an abstract of that data.
We have the comprehensive data that you used to make those.
For the child welfare study?
Yeah.
I don't think you do. I don't even have that data, no. I mean, we have that data in aggregate. We don't have that raw data.
We didn't ask you for the data so we could compare it to what the analysis and the findings were?
Nobody has asked me for that data on child welfare.
Okay.
I'm happy to share whatever.
So is your data that you collect in your surveys available to us?
If you would like, I'm happy to share that data. We just completed a survey that ended on Friday.
Okay. So that's something that the legislature members could.
Happy. Every 6 months, we do a voluntary survey of participants. We just got back, once again, 3,000 responses from across the state of asking. So that's survey data of participants. That's not necessarily rigorous research, but that's good, high-quality survey data with a large sample size.
I think you've testified to the fact that the data you get from those surveys are indeed part of what you use to make a determination that the money is being spent appropriately, that it's being spent in the manner that you at least intend it to be spent.
Right, yep.
Right, so
That's one of the ways that we learn
at the end of the day, the largest donors to the program are the taxpayers of the state of Michigan, whom we all sitting here represent.
Absolutely. Happy to share anything that's requested.
I appreciate that. Representative Miller.
Thank you for giving us such a thorough presentation, and thank you, Chair. I appreciate the opportunity to ask a few questions. I just wanted to get a better understanding how this program is operating beyond the day-to-day operations. I want to get into the consistency and verification, and I just have a quick point. You had said that you trust your families. But for us, it's about long-term accountability. That being said, I just would like you to walk through what organizations or partners, other than what you've mentioned, are involved in administrating the program and what roles they play. And are those responsibilities divided up, and how? And what are your external partners?
Yeah, that's a great question. So I would kind of go back to Give Directly. Give Directly is the administrator of the program. They handle the end-to-end cash transfer for us, from enrollment to verification to the safeguarding, the fraud detection, and the cash delivery, with, once again, multiple safeguards in place at every single step of the way. So Give Directly is the administrator. The program is once again led by Michigan State University College of Human Medicine, because it is a medical intervention, it's a health program. University of Michigan is a partner. They're a founding partner. They're a research partner. And then we work with communities, community champions. Every community that we're in has a champion that helps lead outreach, engagement, and celebration.
I didn't mean champion. I meant, who do you have contracts with?
Oh, contracts. Give Directly, University of Michigan are our main contracts.
So just one organization.
By and large, yeah. Give Directly is the main contractor. They're the main administrator. So MSU handles, for example, the oversight, the leadership, the communications, the community, building work, and they handle the cash delivery.
And if there's an issue that arises, how is that determined? And I won't ask any more questions. Thank you, Chair.
An issue from a participant?
Yes.
Yeah, so there's multiple ways that participants can connect, and then there's staff that are available that reach back out, say it's an issue with a form that was submitted. Many people, they have to submit forms online. I actually did the application this weekend to test it myself, and I submitted. They asked for a utility bill, and I didn't have a utility bill. They're like, this is not correct. You need to submit a utility bill. So if something is incorrect in the application process, they can reach out to staff. They can actually have staff walk them through the application. They can make an appointment with local staff that are on the ground to support them. And those local staff are from those communities. For example, we have a woman in the UP, from the UP, who works for Give Directly for ARCS Kids, that meets with families if they need additional support during that process.
Thank you, Representative. Representative Pohutsky.
Thank you, Mr. Chair. I do just really quickly want to say that I am really uncomfortable with how we behaved in front of the parents and their babies who are here. I personally can't imagine finally having trust in a government program just to be told that you can't be trusted with that program, particularly by people whose entire salaries are taxpayer funded. So I did just want to say that. It was embarrassing to be up here. Dr. Hanna, sorry. There was some conversation about long-term goals and expanding programs or tax credit expansion, things like that. Can you tell me who would be responsible for expanding a tax credit program? Is that MSU? Is that RX Kids? Who expands tax programs?
It's usually states or the federal government.
Great, thank you. And can you touch a little bit on infant death rates, or the inverse of that, and the impact that you've seen with this program?
Yeah, this is incredible, and this is what it's all about, right? So it's about healthier babies. It's about saving lives of babies, and that's what we're seeing. So we are seeing, the state neonatal mortality rate is about 4. That means there's about 4 deaths for every 1,000 babies that are born. And in Flint, that rate has been about a double. Always, it's been about 9 or 10 for several years. And last year was about 5. Okay, so this is a massive decrease in the neonatal mortality rate, which means that more babies are alive. The biggest indicators and predictors of that rate is premature babies and low birth weight babies. And this is the reason, for example, Mississippi wants ARC's kids. Mississippi has a public health emergency because they have the highest infant mortality rate in the country. They have a public health emergency because of that. And so they're looking at solutions, and they're looking at piloting ARC's kids to save babies. And that's exactly what we're doing. Thanks to your support.
Thank
you. Representative Green.
We can't track infant death rates because we no longer track abortions, but that was not my question. My question was, would you, because you were going to provide us data, well, first off, thank you. I will say thank you, moms, for that, because I do support babies and kids. So please don't misunderstand the oversight of this, where we're trying to wrap our brains around where this funding is. My question originally was, will you provide data to separate them? Because I see a lot of those foundations and everything on the list, there's a lot of state pass-through dollars that go through them. And so when we're talking about the state funding and then the private dollars, it's hard to accept that those private dollars aren't then also going to, like, illegals, for example, is a big issue here. So will you please provide that data?
Sure. So you want just the philanthropy versus pure philanthropy dollars?
Yeah, because the philanthropy dollars and how they're going versus, because some of those philanthropy, though, organizations that donate to you also get state funding in one way or another. And
yeah, happy to provide all that separate. And some of the foundations are funding just the research. Some are funding the program. So I'm happy to share any of those details.
So another thing is, in those communities that are on that list, do you partner with the pregnancy crisis centers?
Yeah, we partner with absolutely everybody who cares about moms and babies. Okay. Absolutely. Our materials are in clinics, all kinds of clinics. We have posters that we give. And it's really those community champions that make sure that those materials get delivered everywhere. But absolutely.
Okay, thank you.
Representative Menser.
Thank you, Chair. I think there's been quite a few articles, News Journal articles, about how the population of Michigan is flipping, that you have more old baby boomer dinosaurs like me than you have some of these young babies and kids out here. So this program ensures that more children are being born and born healthy. And I do believe our illustrious president has said something recently about how women need to stop taking birth control and there needs to be more babies born. So I applaud you for the work that you're doing, because you're satisfying one of the president's goals, and you're and you're changing helping change the population. You know, when you look at the fact that you've got more old people like me, you're talking about not only economic issues coming for the state of Michigan, but you're talking about a lot of social issues coming too. And so I think this program is just kind of a miracle. And in the city of Mount Clemens, where I am from, it has made a huge difference. Mount Clemens is a very small community, it's a very poor community, and it's a very overlooked community regularly.
Yeah.
So the fact that you brought that program to us and it's made such a huge difference makes me feel great and not so old. Thank you.
We hear that from folks in the UP all the time. We just got a comment from a mom in the UP saying, don't forget the UP is part of Michigan. Like, thank you for remembering that we're here. We often feel overlooked. Yeah, President Trump had a proposal for a $5,000 baby bonus. We're giving $4,500 in most of our places. So this is actually less than what was proposed by the president to support moms and babies.
And so you're fulfilling one of his goals. And I want to point out, too, again, this is a truly bipartisan program. You've got Representative Kuntz, Representative Schmaltz, Representative Borton, and all the entire UP.
Yep.
In most of the northern lower
Everybody loves
involved in this program. This is a truly bipartisan program that everybody should be proud of.
Yep, it's working. It's all about babies. It's saving money. It's helping our state.
So thank you very much.
Thank you.
Representative Wolford.
Thanks for being here today.
Thanks for having me.
It doesn't matter to me whether Republicans, Democrats, Independents support this program. That's irrelevant to the sake of this being an oversight issue that we look into for the sake of improving things like we've done through this Oversight Committee and UIA, DHHS, and other things of our work and our accountability. And to be frank, well, I'm Jason, but for the sake of that statement, you mentioned when Representative Regas asked about weed and televisions, you said we keep track of that. You alluded to the fact that people aren't doing that because you make sure that's not happening. So you have the ability to track that or look into that, but you don't have the ability to find out if someone's aborting or killing a baby after they get the $1,500 stipend. You know, I would look at maybe taking that $1,500 stipend and putting it at the end so that we know that the baby has been kept. I mean, just something to think about. And, you know, I have a problem with your credibility today because you talked about in your speech earlier that you don't think that this should be a program that goes all the way up through 18 years old, taking care of the child from being born up till 18. And then the video plays where you're stating the opposite of that you do support that, and you're shaking your head yes. So, you know, I don't know which it is. I mean, do you or don't you? Roughly 100,000 babies in Michigan are being born every year. And can you imagine the billions of dollars that this would cost for you to implement this over? Have you thought about that?
Yeah, I have thought about that. And actually, last year, I think the Senate Dems in their building blocks agenda were looking at the statewide plan, like what this could look like for the whole state. I have thought about that would be to improve health for 100,000 babies would be amazing. It'd be amazing how much money we'd save.
So if you, for the sake of time, so if you've thought about it, you know it's an unrealistic goal. And look, by your own admission, this goal is permanent government help. Michigan already provides Medicaid, SNAP benefits, WIC, housing assistance, utility assistance, child care assistance, TAF cash assistance, free breakfast, free lunch, and expanding tuition for college kids. It's out of control. It's not sustainable. And anybody that makes nearly $500,000 should know that. You stated that this is a program and it's a way to rebuild democracy, restore democracy, and reimagine the social contract. That's concerning to me when I see the people that you have on advisory boards. It's concerning to me that you use an organization filled with leftists out of New York. I think that should concern every single taxpayer. And I guess at the end of the day, this hearing isn't about whether we care about mothers and babies, because we do. I applaud those that came, that are stay-at-home moms. I applaud those that came who have jobs and maybe had to take a sick day so they could come. But that's regardless. I guess I would just say this in closing, Mr. Chair. You stated that a government-scale public program, that you want this to go far beyond infancy. So those statements raise serious concerns to me. There are people paying bills that deserve answers. There's people that are in their 20s and above that are working 2 jobs, delivering food at night, and that money, this money that we talk about today, you're taking from them and giving it to people by your own admission to illegal aliens, and also with using self-attestation. Trust me, I'm who I say I am. I've got a very big concern with this, and so I'm thankful to Oversight in this hearing. Thank you.
Thank you, Representative. Representative Conlon.
Thank you so much for being here today. So the legislature has voted yes on this program in 2024 and in 2025. Is that correct?
And 2026.
And in 2026. So now we are looking at this, and that was the majority of legislators. This passed through bipartisan. So what has changed to make them be looking at it now?
Nothing has changed, except we are in more places. It is still a place-based program. The design is the same.
So nothing has changed since we voted
It's gotten better.
on it.
We always continuously improve. We learn, we grow, but the design has fundamentally not changed and since it was first voted on in 2024.
And secondly, we have a healthcare crisis in the country around our nurses, a shortage of doctors, nurses. I have a friend who's a baby cuddler, a male friend at Mott, because they don't have enough people to hold those premature babies. Can you tell me how this has affected our healthcare providers and helped our nurses and doctors?
Oh, that's a great question. So we actually just released a study on the impact this program has had on providers, on physicians, and it has improved wellness and decreased burnout. When physicians are unable to address those root social determinants of health, it creates a moral crisis. And this is something that is finally in that toolbox of providers to help address those issues so they can spend more time addressing what brings that patient in. So we actually just once again released a study that shows that this is improving provider wellness. Burnout of physicians is a national problem, and reducing that moral crisis. Thank you.
All set, Representative Conlon? We're going to try to get through this. We are a couple minutes over, but in the interest of everybody's ability, Representative McNeil.
Thank you, Chair. I keep editing my question as it goes on. Thank you so much for being with us today, Doctor, and I really appreciate the wonderful work you're doing. I often hear in Lansing that what we need to do as a government is to respect Michiganders, remove red tape and rules, and trust our people, trust our families, trust our heads of household, our mother, even our corporations. Get the government out of the way of the people, because families know how to spend the money that they have to make their families safe. For some reason, that's not true in this hearing, but maybe only in this hearing, and we know it is true. And I understand that if you add a bunch of checks and balances to these cash payments, start tracking potato chips and sodas, that we will not be spending 85% of the dollars you're talking about on babies.
It'd be much more expensive to administer.
Then we will be talking about, I think someone in this meeting scowled at the concept of administrative costs. Administrative costs are what you add when you start doing all of these things. And I guess I also just want to add, I just thank you for what you do, and add that babies born in America are American citizens, and they are babies who deserve to live. Thank you.
Thank you.
Thank you, Representative. So, as just to kind of close out here, so going through this, I mean, my eyes were open to a lot of things. Again, I say to you that our role is to look at this from an objective perspective. It's not a debate about do we love babies and moms, because everybody sitting up here does. That's not even. It's the reality of the management of this kinds of things. And I found lots of things, and I addressed some of them with you, that concern me greatly about involvement, motivation, people who are near and dear, and what we're actually trying to accomplish beyond just helping moms and babies. And Representative Wolford touched on an item when he was speaking, which concerned me. And I do have, Mike, if you don't mind, would you just run video 9 for me really quick?
Celebrating this kind of historic program, we were coming around. Look at the baby, we had babies, and that's so good. And we had a marching band. The mayor was the grand marshal. We had American flags because we're stealing back patriotism. Because this is how we care for each other.
Some folks are done with the American flag anyway.
We're stealing it back.
You're flying it upside down.
That's true. That's true.
Who are we stealing patriotism back from?
This, to me, is the most patriotic program. And this is fundamentally how we should be taking care of our babies. So this is, to me, what it means to be an American, is how we take care of babies.
But who are we stealing it back from?
We are embracing that this is a patriotic ideal, that we are taking care of babies. This was images from a baby parade, which we have in many of our communities. Baby parades were started in the 1920s to draw attention to the needs of mamas and babies as an American celebration.
Well, in all fairness, those were images, correct? But those were your words. Who are we stealing patriotism back from? That's what I don't understand.
Yeah, we are embracing patriotism.
So we're not stealing it
with this. We are making sure that all individuals can love America. I love America. Sure. I love what America is and what America can be. And this is a program that embodies how we can love America, especially our babies.
Well, with all due respect, the answer to the question in the statement don't line up. But I will say, I appreciate you coming. I appreciate you talking with us.
I appreciate this opportunity.
And we'll talk again, I'm sure.
Thank you. I appreciate it. Thank you to everybody on behalf of thousands of babies. Thank you.
Representative Regas moves to excuse absent members. Being no objection, the motion prevails by unanimous consent. Being no further business before the committee stands adjourned.